A deadly virus, a country already suffering from conflict, and now health experts fear the situation could spiral completely out of control. The World Health Organization has issued a major warning after a deadly Ebola outbreak in the Democratic Republic of Congo reportedly killed more than 130 people, while hundreds of suspected cases continue to rise. But what makes this outbreak even more terrifying is that experts believe the real numbers may be far higher than what's officially reported. And according to health authorities, this crisis may already be spreading faster than expected. So what is really happening inside Congo right now? Why are experts so worried? And could this outbreak become a global threat? Let's break it down. The center of this crisis is Ituri province, located in Eastern Democratic Republic of Congo, a region already devastated by armed conflict, poverty, and humanitarian instability. Medical teams returning from the area describe scenes of chaos and fear. Hospitals are overwhelmed, many villages are difficult to reach, and thousands of people are constantly moving due to violence in the region. Now imagine trying to contain one of the world's deadliest viruses in the middle of a war zone. That's exactly the challenge health workers are facing right now. And according to experts, the outbreak may already be much larger than the official numbers suggest. But here's where the situation becomes even more dangerous. Scientists now suspect that this outbreak may involve an unusual Ebola strain. Normally, health officials use standard testing methods designed for the most common Ebola variants. But reports suggest this strain may not have been detected immediately during the early stages. That delay could have allowed infected individuals to move between communities without knowing they were carrying the virus. And in outbreaks like Ebola, even a few days of delayed detection can completely change the scale of the crisis. Now emergency teams are racing to trace contacts across eastern Congo before the virus spreads even further. As the outbreak grows, another massive problem is making the situation worse. There simply aren't enough medical supplies. Health workers say clinics are running dangerously low on chlorine used for disinfection. Protective suits for doctors and nurses are becoming scarce, and even basic burial equipment is reportedly in short supply. That's critical because Ebola spreads through bodily contact, meaning safe handling procedures are essential to stop transmission. Without proper protection, frontline healthcare workers themselves can become infected. And once hospitals start losing medical staff, containment becomes much harder. Right now, international agencies and emergency teams are rushing to contain the outbreak before it turns into an even larger disaster. The World Health Organization, local authorities, and humanitarian groups are expanding testing, building treatment centers, and warning people to report symptoms immediately. Health experts say the next few weeks could determine whether this outbreak is controlled or escalates into a much wider regional emergency. For now, the world is watching closely because history has shown us that outbreaks ignored in the beginning can become global crises later. What do you think? Can the outbreak be contained in time? Comment your thoughts below. And if you enjoyed this breakdown, don't forget to like the video and subscribe for more world crisis explainers and global news updates.